A 7-hour meeting brokered by the House of Representatives Committee on Healthcare Services between resident doctors and the federal government ended in a deadlock on Tuesday. The striking doctors are insisting on the implementation of the Memorandum of Action of the 9th of April 2021. National Assembly correspondent ADISA reports.
Directly, sir.
No, let him.
It's the second day of the intervention efforts by the lawmakers in the face-off between resident doctors and the government. One after the other, the committee brings the issues in contention before the parties. These include funding of residency training, a circular mandating the removal of house officers from the scheme of service, and payment of about 5.5 billion naira in salary arrears, including arrears of consequential adjustment of minimum wage.
See how we can fast-track measures to ensure that average persons that are not party to that omission or commission are not punished. Because if we continue like this, those who are supposed to be paid are punished. Those who are supposed to benefit from the services and are not benefiting are also punished.
For once, the CMDs and the striking doctors agree there was no basis for the controversial circular compelling the removal of house officers from the scheme of service.
The house officers and the NYC doctors, especially when he gave me gave us the composition of the Council on Establishment, people from the state came. Let me tell you the truth. Most of the general hospital owned by the state, they are manned by the NYC doctors.
Appealing to, please, Director of Budget, Honorable Minister of Head of Service, please try to make sure that you have made proper arrangement in every year budget to make sure that these doctors, they have enough fund for their salary and their allowances.
The doctors also vow to continue with the strike if their members employed in the wake of emergency brought about by the outbreak of COVID-19 are not paid.
The essence of us being here is to try and bring back services to Nigerians as a whole. Sir, what would be my take home from this honorable place?
After 7 hours of so much back and forth between representatives of the resident doctors and government officials, the striking doctors did not seem convinced that much has been achieved at this meeting. Are you satisfied with the outcome of this meeting?
I'm not, obviously. I'm told to come to the Minister of Health. We as responsible individuals and a responsible union will keep on towing the line of dialogue, hoping that one day they will get it right.
The lawmakers have set up a committee comprising the Health Ministry, Chief Medical Directors, unions in the sector, and regulatory bodies to address issues of emergency requirements of health workers. ADISA, TVC News, Abuja.